talk about breast diseases and not so much breast cancer, although that's going to be part of the talk, but talk about breast diseases and breast lumps and what those actually mean to the woman when they find them. Before we go into breast diseases, we need to understand what the breast is composed of. The breast basically is composed of the outer layer of skin, a layer of fatty tissue beneath the skin, and then beneath that is the glandular tissue, and then the ducts that lead the glands to the nipple area. So there's a lot of different components to the breast that can give rise to lumps or abnormalities that can be found on examination or testing. Of course, in the skin of the breast is no different than skin elsewhere in the body. You can have lumps in the skin such as skin cancers or sebaceous cysts, which are little oil sacs that develop underneath the skin that can get infected. In the fat tissue of the breast, you can develop lipomas, which are benign fatty growths in the breast that, again, are non-cancerous and really not anything to be overly concerned about. But the breast lumps that we're here to talk about are occurring in the glandular tissue and the ductal tissue of the breast. Of course, the breast also drains to lymph glands, and the lymph glands that it drains to are the axillary lymph nodes in the armpit, which you can feel by examination. And then there's another set of lymph nodes up underneath the collarbone and underneath the breastbone that you cannot feel by examination. Benign breast lumps or breast changes occur in approximately 75 to 80% of all breast lumps that are found. So when a breast lump or a breast change does occur, it doesn't mean that something bad is going on. About 75 to 80% of the time, something non-cancerous is happening there. And the most common conditions, the most common benign conditions of the breast are a fibroadenoma, fibrocystic change or lumpy breast, which I'm sure you all have heard quite a bit about, and ductal papillomas. And those are the three most common benign causes of breast lumps. A fibroadenoma is a benign tumor composed of glandular tissue and fibrous tissue, and it's most common in young women. Usually occurs between the ages of 20 and 40, and it's the most common mass found in teenage girls, prepubertal teenage girls. And it's usually painless. It's usually kind of rubbery feeling, moves around quite a bit. Can be by itself or it can occur in multiples. And again, it doesn't change with the menstrual cycle as some lumps do. Again, it's a benign tumor or a benign growth, and it can be diagnosed as benign or tumor with biopsies, and it can be surgically removed if it's growing. One of the most common benign changes that occur in the breast is called fibrocystic change or fibrocystic disease, and it's the lumpy breast. It's the most common occurring breast change that goes on, and it's most often seen in women between the ages of 35 and 40, although it can occur younger and older. It basically is in response to the female hormones, estrogen and progesterone, that have been cycling up and down in your body for month over month for years and years. And it's these changes in the female hormone that have given rise to the changes in the breast tissue and the gland tissue that causes this condition. It can cause lumps in the breast where cysts form or sacs of fluid form, and they can be painless because they're under pressure. Or it can be multiple small cysts that are microscopic that cannot be felt, but again give rise to inflammation and pain in the breast. There's many things that can be done to treat the symptoms. One of the things to use is mild analgesics like ibuprofen, anti-inflammatory medication. Warm compresses help when the condition is really painful, and using a sleeping bra instead of going braless at night, and also wearing a good fitting bra during the day. A low-salt diet helps. Restriction of caffeine and chocolate is very important, and it's probably one of the hardest things to do, but it's probably one of the most helpful things to do with fibrocystic disease. And I'm not talking about going from 5 Cokes to 3 Cokes a day. I'm talking about cutting caffeine completely out of the diet, going to completely decaffeinated soft drinks, coffee, tea, and limiting the cocoa and chocolate in your diet. And that will help the symptoms of this condition. Vitamin E supplement in the form of a pill daily has been shown to help with the symptoms. And in very severe conditions, they're really debilitating. There's a special hormone treatment that can be used, but that can be given, but I don't remember ever having to use that. But all of these things help the symptoms of fibrocystic disease, but there's not actually any cure or any magic pill or treatment that makes the condition go away. It's usually something that just has to be tolerated. And when these cysts form in the gland tissue, these sacs of fluid, they can be treated by aspiration, where you can actually draw the fluid out of the cyst and therefore relieve some of the pressure in the breast. Of course, when a lump is found, or a woman's concerned about a lumpy breast or lumpiness that's occurring in the breast, the most important thing to do is to find out whether it's this benign condition or is it something serious, such as a cancer. And of course, that's where we go to our imaging tests, our x-rays and other examinations. Another less common benign tumor, again a non-cancerous lump, is actually a lump that can't be felt. But it does occur, and it's a ductal papilloma, and it occurs beneath the nipple, right beneath the nipple, in the duct that drains the nipple. And the way that you know that you may have that is you'll have a discharge from the nipple, either a clearish discharge or a bloody discharge. And if that occurs, then you need to have a physician examine and evaluate and diagnose what this discharge is coming from. More often than not, it's coming from this benign tumor called intraductal papilloma, which can be removed surgically if it's causing significant problems. Of course, a bloody discharge can also be caused by breast cancer, so it's very important that any type of bloody discharge be evaluated by a physician. Let's talk a minute about the risk factors for breast cancer. Again, we talked about 80% of the lumps you're going to find in your breast are not cancerous, and that's a good thing. But that also means that 15 or 20% of the ones you find in your breast possibly could be cancer. What puts you at risk for cancer? What makes you different from another woman that may make it more important that you check for lumps and you see that these lumps are evaluated? 80% of all breast cancers occur in women ages 50 or greater. Oops, excuse me. What that's telling us is that breast cancer, one of the greatest risks of breast cancer is advancing age. Breast cancers are going to occur more commonly as you advance in age, and that makes sense because your body is subject to the rises and falls of your estrogen and progesterone hormones in your body. Personal history of breast cancer or other cancers such as ovarian cancer. In other words, if you've had breast cancer before or ovarian cancer, that puts you at higher risk for developing breast cancer again, even though you've had it one time. So again, women who have had a personal history of breast cancer or ovarian cancer need to be very closely watched and very closely followed. Personal history of fibrocystic changes in the breast. This is a bit of a misinformation, because fibrocystic disease or changes does not actually cause breast cancer, but a woman with fibrocystic disease in the breast that has very lumpy breasts may find it difficult to find a lump or to find something that may be dangerous or cancerous. And also the imaging tools such as mammograms and ultrasounds may find it more difficult to pick up or detect breast cancers because of the condition of fibrocystic disease. Family history of cancer, specifically a family history of breast cancer or ovarian cancer. If you have a close family member sister, mother, grandmother who has had breast cancer or ovarian cancer, that puts you at increased risk for developing breast cancer in your lifetime. Other risk factors include some personal things about your health. If you started your periods earlier than age 12 or developed menopause later than age 55, then you have a slightly increased risk of developing breast cancer. If you never carried a pregnancy to full term or had children but never breastfed them, that also puts you at slightly increased risk. And if you were 30 years or older at the time of your first term pregnancy, that puts you at slightly increased risk. These risks here are not nearly as important as the risk of family history. And any one of these, you may be sitting in the audience today and say, oh, that's me, oh, that's me, oh, that's me. Well, that doesn't necessarily mean that puts you at greatly increased risk. It's a relatively slight risk, but those are risk factors. Environmental and lifestyle changes or conditions. Obesity, overweight women are at increased risk. Having a poor diet, smoking puts you at increased risk, or excessive use of alcohol. Sedentary lifestyle. These are all may contribute to an increased risk of breast cancer. And most of this has to do with the obesity and the poor diet and the sedentary lifestyle has to do with estrogen again. Estrogen in your body tends to want to go and deposit in areas where there's fat tissue. So a heavier person may carry estrogen around circulating in their body more so, and a breast cancer is stimulated, not caused, but is stimulated by estrogen in the body. So that puts you at increased risk. This is an interesting bar graph that basically talks about the lifetime risk of breast cancer. In the general population, if you took 100 women and put them in a room, 12% of them, or 12 of them, will develop breast cancer in their lifetime. So that's a fairly significant number because 1 in 8 women will develop breast cancer in their lifetime. That makes breast cancer the second leading cause of cancer in women behind skin cancer, and it's the second leading cause of death in women behind lung cancer. And approximately 230,000 women annually will be detected with new cases of breast cancer, and approximately 40,000 women a year die of breast cancer. This bar graph here tells us about the familial aspect. In other words, if there is a family history of breast cancer in your family, a strong family history with sister, mother, maternal grandmother, that increases your risk from 12% to anywhere from 20 to 30%. Again, that does not mean you're going to get breast cancer. It just means that you need to be followed more closely, and we need to detect things earlier if we can find them. And this last bar graph is hereditary. What that means is that you have a family history of breast cancer, but you also have a mutated gene in your DNA. And this is relatively new material here. It's called the BRCA gene mutation, and it's determined by a blood test. And again, if you have this mutated gene, then you have a 60 to 87% chance of getting breast cancer. The good thing about this gene mutation, is that only about 2% of breast cancers are due to this. Most of breast cancer that is found in women is not due to a genetic mutation. But if you do have it, then there's an extreme likelihood that you'll develop breast cancer because of that genetic mutation or DNA abnormality. Let's talk a little bit about the BRCA mutation. This is the genetic predisposition to breast cancer. A mutation in the BRCA1 and BRCA2 genes, those are two different genes in your DNA, make up for a 60 to 87% risk of developing breast cancer in your lifetime. So if you have a strong family history of female cancer, such as breast cancer or ovarian cancer in your family, a blood test can be done to determine if the mutation exists. And it's a patient's prerogative if they want the BRCA analysis testing or not. And you may say, okay, well, if this identifies a gene in my body that's abnormal and it means almost certainly I'm going to get breast cancer. Why doesn't everybody have this blood test? Well, again, it's only because only about 2% of breast cancers are due to this. So it's not really recommended that it's a screening technique at this time. Insurances aren't going to pay for every woman to have this blood test. And then that's not the only reason, the fact that insurances won't pay for it. It's just not economically feasible, and it's not feasible for the patient to do it that way, because it's just a very few of the cancers are due to this. But if you do have a strong family history and you've developed breast cancer at an early age, then this is what's recommended by surgeons and physicians, is that you have this genetic testing. It helps not only you, but it helps family members, female family members that are close to you, and your offspring as well. Screening and detection. When you find a lump and you're concerned about it and you don't know what it is, then the best way to do it is the best way to go about seeing about it is going to a physician and having it evaluated. Early detection. I can't impress those two words upon you enough. Early detection is the key right now with breast cancer. If we can find things, if you can find things and your physician can find things in the breast that are abnormal and concerning early, then we've got an excellent chance, if it is cancer, of curing this cancer. Not helping it, not palliative, making your life go longer, talking about curing it. Finding it early is the best way. And the three ways that we screen people, first of all, this is the patient's responsibility, self-examinations. Monthly self-examinations of your breasts at home should be done on a routine basis. After the monthly exams, the next thing is the clinical breast exam. That's an exam that's done by a physician or a medical professional that understands how to appropriately check a breast for abnormalities. And of course, mammograms. And there's been a lot of controversy and talk about mammograms, who should have them, who shouldn't, when they should have them. Again, my feeling and most of the feeling of physicians at this time is still that you have a yearly screening mammogram at age 40 and yearly after that. And if you're high risk, if you have a strong family history of breast cancer or ovarian cancer, your physician may want to get a baseline mammogram earlier at age 35 and then go from there. But again, yearly mammogram starting at age 40 is still recommended at this time. Let's talk about some of the changes that you can see externally on the breast that may be warning signs or concerns that a cancer may be developing. First of all, superficial veins. The appearance of, or the new appearance of small veins that you can see, spider-like veins that occur on the breast, in one area of the breast and only on that breast and not on the other, may be a sign that something is going on. Discharge from the nipple, especially bloody discharge from the nipple, is somewhat of a concern and needs to be looked at and evaluated. Inversion of the nipple, and this is not inversion of the nipple that's been there for years and years and years. This is something that's new, something you've noticed that's a change. In other words, if the nipple heretofore has been protruding and it starts to dimple or retract or pull in one side, that may be an early sign. Skin dimpling, an area of the skin that starts to dimple or pull in towards the breast a little bit, may be a warning sign. Changes in the skin texture, such as swelling or a little dimpling of the skin. It almost looks like an orange peel. If you know the texture of an orange that has a little dimpling effect to it, if you see that in any one area of the breast, that may be a concern. And of course, a lump. A lump is something that you'll detect by examination internally, but these other things are external factors that may give rise to a concern about a lump being cancerous. So you found a lump in your breast at home. What now? What do you do next? Well, first of all, you need to obviously see a physician and have it evaluated. Most of the time, that first physician is going to be your primary care physician, either your OB/GYN physician, family physician, internist, the such, or it could be a general surgeon. Most of the time, your primary care physician, if a lump is detected, your primary care physician will refer you to a general surgeon to have further examination and evaluation and treatment. The ways that, that we evaluate a lump in the breast is through these 4 ways: needle biopsy, image-guided biopsy, surgical biopsy, and breast ultrasound. Breast ultrasound is more commonly used now than it has been in the past, and many of you who have had mammograms may have had ultrasounds in conjunction with that. And the reason that that's occurring more often is because ultrasounds are becoming better at looking at lumps and determining whether the lumps are abnormal or not. An ultrasound of the breast will determine whether a lump is solid, has tissue in it, or cystic with fluid in it. Because if it's cystic, it's probably not cancer. If it's solid, it's probably not cancer, but it's got a better chance of being cancer than the cystic one. So it needs to be evaluated more fully. So an abnormality on your mammogram may be followed by a breast ultrasound to see whether they can discern more information about that lump and help the surgeon determine what next needs to be done. The 3 things that are done to identify the lump and to tell us what it is, what kind of cells is it composed of, is these 3 biopsies. The biopsies are different types, but they are done by different physicians usually. A needle biopsy is usually done by the surgeon or the pathologist. An image-guided biopsy is usually done by the radiologist or the surgeon, and of course a surgical biopsy is done by the general surgeon. Again, your doctor may have you get an ultrasound of the breast to determine whether that lump is cystic or solid, and it can also determine the exact location of that lump if you're unsure exactly where it's located in the breast, to assure that a proper needle placement for a biopsy is done. Needle biopsy is not done very often. It just involves placing a needle into the mass and just withdrawing a few cells. It doesn't take out the mass. It doesn't give the pathologist a lot of tissue to make a diagnosis. But it can be done to identify whether a mass that's obviously large and looks like cancer is cancer or not. These are very common. Image-guided biopsies. If you have a lump in your breast that's suspicious, that's labeled as suspicious by the mammogram and or ultrasound, then you more than likely will have one of these things. Either a stereotactic guided biopsy or an ultrasound guided biopsy. A stereotactic guided biopsy is where they put you in a special mammogram machine and identify where the lump is, and under local anesthesia they place a larger needle to actually take some core samples of the mass out. And sometimes smaller masses can actually be completely removed this way. A ultrasound guided image biopsy is where they just put the ultrasound probe on the breast and identify where the mass is, and again use a core needle to go in and take core samples of the mass. That gives us plenty of tissue so that the pathologist can make a good recommendation or a good determination of what that lump is, if it's cancerous or not. If none of those can be done, and sometimes the image-guided biopsies can't be done technically, and so the lump is still there and we still don't know what it is, well then a surgical biopsy can be done, and that's basically where you go to the operating room and put to sleep for a short procedure and make a small incision overlying the lump and take the lump out. If you can't actually feel where the lump is, but it's known to be in the breast by the ultrasound or the mammogram, then what's done beforehand is what's called a wire localization, where the radiologist will actually put a wire into the breast and put the end of that wire right next to the lump or in the lump, so the surgeon's able to use that wire as a marker to go to the end of that wire and take out the lump, and therefore you know you've removed the right area that's concerning to be able to make a diagnosis. Once the biopsy is done, again, 80% of the biopsies are going to be benign. They're not going to be cancerous. 20% are though. So if you've received a diagnosis of cancer, it's not a death sentence, because if it's found early, if it's small, if it's detected early, and it's stage 1, then we can potentially cure that cancer. The next step, you'll return to the surgeon's office once a diagnosis has been made, and you'll discuss several types of treatment. And the treatment of breast cancer, in almost all instances, is surgery first. Occasionally, if a woman has a far advanced breast cancer, one that was not detected early and has spread and metastasized elsewhere in the body, occasionally chemotherapy or radiation therapy or hormone therapy will be done before surgery or in lieu of surgery. But surgery is usually the first thing that's done. And there's a variety of different types of operations that can be done to remove the cancer. A lumpectomy, a partial mastectomy, or a mastectomy. A lumpectomy and a partial mastectomy just means we're removing part of the breast, just the part of the breast that has the cancer in it, not removing the whole breast. And of course, we're leaving, if we just remove part of the breast with the cancer, we're leaving the remainder of the breast intact and there. And so on top of that, after surgery is done and the woman is healed, radiation therapy has to be done to the remaining breast. That's part of the process of lumpectomy and partial mastectomy. Mastectomy means removal of the entire breast and the lymph nodes in the armpit, and that's another treatment for breast cancer. Although the lumpectomy and partial mastectomy are being done more often, we've found that we don't have to remove the whole breast and all the lymph nodes to be able to, number one, treat the patient properly, and number two, achieve a stage that we can treat. So we're doing less surgery and accomplishing the same thing as far as treatment. Chemotherapy is intravenous, given intravenously. Radiation therapy is X-rays that are given to the cancer area, and hormone therapy is a pill. Actually, it says hormone therapy, but actually it's a pill that will negate the effects of your female hormone in your body, either by decreasing the amount of female hormone, estrogen or progesterone that's circulating in your body, or actually blocking the female hormone from attacking the cancer cells and causing them to grow. So there's some things you can do to help your situation in dealing with the risk of breast cancer. This slide says prevention, and I think, again, that's a misnomer. To me, prevention means you're going to do something, and if you do what you've been asked to do, you're not going to get this disease or this problem. And that's not necessarily the case. If you do all these things that we're suggesting, it doesn't mean you're not going to get breast cancer. It just means that it decreases your risk of getting breast cancer. So the things that you can do for yourself as a woman: do not smoke, limit alcohol intake, maintain a healthy weight, exercise regularly, eat a healthy diet. And you say, well, golly, that's something we should be doing anyway. You're right. That's something everyone should be doing. But all these things decrease the risk for developing breast cancer. Again, I want to thank you all for coming, and I hope you learned a little bit about breast disease and what a lump means when you find it in the breast and what to do about it.